I'm just checking Wendy's breathing. I can't feel my hand going up and down. I can't hear any sound. I don't think she's breathing at all. Situations change like this all the time. I need to roll her back onto her back very quickly. Quickly check her airway again. It's clear. I think, no, she's not breathing. I'm going to go get some protective equipment from my first aid kit. Although it's unlikely to catch any disease from someone's mouth when you're doing CPR, we always encourage you to use, particularly in the workplace, some form of barrier. There are a couple of types. This is a face shield barrier, which is a keyring barrier. You can come and actually carry it on your keyring. It's just a plastic bag with a valve in it, really. That just sits over Wendy's face. We pinch the nose, still do our pistol grip, tilt the head back and breathe through that hole like so. I have a pocket mask here, a face shield, which is a protective barrier. Yeah, the way to do it, guys, is to pop this out like so. It also has a valve that goes in here. That then goes over Wendy's face. We then press down and give her 2 breaths. The positioning of your hands in CPR is not all that important. It's much more effective in the centre of the chest, right here. You can do CPR from here to here, hard section up here to hard section here, not on the soft section of the stomach, of course, but it's much more effective right here in the middle of the chest. Place our hand like this, arm up like so. The compression rate is 30 compressions on the chest, followed by 2 breaths, continuously till help arrives. The speed of resuscitation is not all that important, but you are trying to achieve 100 compressions per minute. So it's quite fast and quite exhausting. However, when you are compressing on the chest, you may hear ribs cracking. In fact, it's probably cartilage cracking. Please don't worry about that, it's quite normal. If you hear a cracking or a crunching sound, the last thing I want you to do is stop CPR. Your adrenaline will be pumping. Please keep going with CPR. As I said before, it's actually resuscitating the brain. By pumping blood from the heart to the surface of the brain, it's keeping it alive until emergency help arrives. That's all we're really doing with CPR. Now start immediate CPR. 1, 2, 3, 4. Let's just step through the whole procedure here to start CPR. The first thing is we ensure it's safe. No dangers around the area to cause us any problems to us, the rescuer. Secondly, we check her airway. We open her airway, we have a look inside her airway to make sure it's clear, and tilt her head back slightly. Then we check for breathing. We look, listen and feel for breathing. We then do 2 rescue breaths, as I demonstrated before, and we do 30 compressions on her chest. It is important you get your arms straight and try and use the heel of your hand rather than your flat hand on her chest. And to locate the position of where we do CPR, it's quite easy these days. Is all we do is visualise the centre of the chest. So about here, on the hard surface of the chest. Hold our arms together, keep our arms straight, get up nice and close, heel of hand and press up and down on her chest. Now we press up and down 30 times, then we breathe 2 times. 30 to 2, 30 to 2 until the ambulance arrives. 30 to 2 is for small children, for babies and for adults. Of course we modify our CPR slightly to suit those age groups. Child and infant CPR. When performing CPR on a child or infant, it is important to modify the process slightly to suit their age groups. For infants, only 2 small puffs, about the amount of air that you can puff out of your cheeks. Compression, about 1/3 of the chest depth. You'll only need to use 2 fingers to perform compressions in CPR. Do not tilt their head back at all. Keep them in the neutral position. Do not overinflate their lungs. With a child, only requires 2 small blows, a little bit more than you would need for an infant. Compressions don't need to be as deep or not as hard as an adult. Do not fully extend the neck of a small child. Put their head in what they call the sniffing position. Remember, CPR is about keeping the brain alive, providing oxygen through the blood from the heart to the brain, not bringing people back to life.